Welcome to the Asthma Self-Management Workshop 2014. This is lecture number 3. This lecture is based on GINA guidelines for the year 2013. GINA stands for Global Initiative for Asthma. Today we are going to talk about the written Asthma Action Plan. The Asthma Action Plan is used during flare-ups. What are flare-ups? A flare-up or exacerbation is an acute or subacute worsening of symptoms and lung function compared with the patient's usual status. It is important to treat early using the Asthma Action Plan. It is also important to identify risk factors for the flare-ups. What are the symptoms of an asthma attack? A person may complain of chest tightness, or he or she may say, "My chest hurts," or "I cannot catch my breath," or "My throat is tight," or "My mouth is dry," or "My neck feels funny." He may also complain, "I don't feel well," or "I feel tired." It may even be, "My chin or neck itches." What are the late symptoms and signs of asthma? They are wheezing, shortness of breath, rapid breathing, gasping for breath, or low or falling peak expiratory flow rates. What is a written asthma action plan? The plan shows how to recognize and respond to worsening asthma. It is individualized according to the level of asthma control and health literacy. It is based on symptoms and/or peak expiratory flow. It includes asthma medication prescribed for control. It tells how and when to increase reliever and controller medication. It tells when and how to start oral steroid, and when to access medical care if symptoms fail to respond. This is a sample written asthma action plan to be filled in by the doctor or healthcare professional. This is the upper portion of the written asthma action plan. The name of a person is written down. The doctor's name is also written down, and the date when this asthma action plan was written. The contact number of the doctor and the contact number of the hospital or emergency room. The upper portion of the asthma action plan is the green zone. When the person is in the green zone, the person is doing well. There is no cough, wheeze, chest tightness, or shortness of breath during the day or night. The person can do the usual activities. And the peak flow measurement is above 80% of the personal best. It is important to jot down the personal best peak flow meter reading. On the right hand part of the plan is written the control medicine, also known as the preventive medicine, which includes anti-inflammatory drugs. The name of the medicine is written down here. The dosage of the medicine written down here, and when should it be used. Control medicine or preventive medicine should be used daily with or without symptoms, even when the patient is doing well. At the bottom is advised when to use medication before exercise should the person be known to have exercise-induced asthma. Usually it is salbutamol, the number of puffs to be taken, time to be taken before exercise is also written here. The middle section of the Asthma Action Plan is the yellow zone. The yellow zone is when asthma is getting worse. There is cough, wheeze, chest tightness, or shortness of breath. The person is also waking at night due to asthma, or the person can do some but not all normal activities. The peak flow measurement is about 50 to 80% of the personal best. So this is the yellow zone when the asthma is getting worse. The first thing to do is to add quick relief medicine, which is usually a short-acting beta agonist, like salbutamol. It is important to realize that one must continue using the medicine in the green zone, which usually is the controller medicine. So quick relief medicine can be used 2 or 4 puffs every 20 minutes for up to an hour. Or if one has a nebulizer, one can use the nebulizer once. After that, if the symptoms improve, if the symptoms return to the green zone, or if the peak flow meter reading return to the green zone after 1 hour of the above treatment, then one should continue using the quick relief medicine every 4 hours for 1 to 2 days. One should also double the dose of the inhaled steroid for 7 to 10 days. However, if the symptoms or peak flow meter reading do not return to the green zone after 1 hour of the above treatment, then one should use the short-acting beta agonist like salbutamol 2 or 4 puffs, or continue to use the nebulizer once. Now it is time to add oral steroid, usually in a dose of 30 to 40 mg per day for the next 3 to 10 days. It is also time to inform the doctor of the current situation and to seek advice within an hour or so, because then you want to know how much of the beta agonist to use, or should one run into trouble, when to go to the hospital. The red zone is the medical alert zone. Here the person is very short of breath, or he feels that the quick relief medicine has not helped, or the person cannot do his usual activities, or the symptoms have gotten worse or remain the same in the yellow zone after 24 hours. The peak flow reading now is less than 50% of the personal best. The person needs to continue taking the short-acting beta agonists like salbutamol 4 to 6 puffs every 20 minutes until help arrives or he arrives at the hospital. And he should also continue using the oral steroid which has been prescribed in the yellow zone. He may also use the nebulizer once until he arrives at the hospital. One should call the doctor now or go to the hospital, especially after 15 minutes in the red zone where the earlier medicine has not made the situation better. Danger signs will be trouble walking and talking due to shortness of breath, or the lips or fingernails are turning blue. Then one should continue to use the salbutamol 4 to 6 puffs regularly every 20 minutes, or even worse, during asthma first aid treatment every 4 minutes, until help arrives or one is able to reach the hospital. To recapitulate, act immediately while in the yellow zone. Stay calm and away from any known allergen. Use a reliever medication. Start administering 2 puffs. One can repeat the use of the reliever medication every 20 minutes for the next hour if the symptoms continue or return, or the person has trouble breathing, or the peak flow reading is below 80% of personal best. Asthma first aid should be considered when the condition is deteriorating rapidly from the yellow zone, or when the person's PEFR, peak flow reading, is well below 50% despite repeated administration of a reliever medicine like salbutamol. Sit the person upright. Give 4 puffs of reliever or salbutamol. Wait for 4 minutes. If there is no improvement, give another 4 puffs. Keep giving 4 puffs every 4 minutes. 4 puffs every 4 minutes until emergency assistance arrives or one is able to reach the hospital. This should be done in asthma first aid, which means that the person has deteriorated rapidly from the yellow zone into the red zone and is not coming back to the yellow zone despite repeated use of beta agonist.